A navicular drop test is to determine if there is excessive pronation of the foot. Athlete is sitting with both feet on the floor. Examiner places a dot over the navicular tuberosity with the athlete in a non-weight bearing position. Examiner kneels in front of the athlete and places the subtalar joint in the neutral position with the athlete's foot flat against the ground but non-weight bearing. Examiner positions a 3x5 index card next to the medial longitudinal arch and makes a mark on the card corresponding to the level of the navicular. Examiner has the athlete stand with his or her body weight evenly distributed and marks the new level of the navicular on the card. Examiner measures the distance between the two marks. A positive test is navicular drops more than 10 millimeters. Positive test implication means hyperpronation of the foot. For the Feist line test, athlete is sitting with his or her feet off the end of the table. Examiner places a mark on the apex of the medial malleolus, the navicular tubercle, and the plantar aspect of the first metatarsal phalangeal joint, and draws a line connecting the marks. Examiner has the athlete stand with his or her feet approximately 1 foot apart and the weight evenly distributed. Examiner marks the new position of the navicular tubercle. A positive test is the navicular drops more than 10 millimeters. Positive test implications mean hyperpronation of the foot. In a Thompson's test, athlete is prone with his or her knee extended. Examiner squeezes the calf musculature while observing for ankle plantar flexion. A positive test, foot does not plantar flex when calf is squeezed. Positive test implications, Achilles tendon rupture. For a heel tap bump test, athlete is sitting or lying supine with the involved foot off the end of the table and the knee straight. Examiner stabilizes the lower leg with one hand and bumps the calcaneus with the other hand. Examiner bumps the calcaneus 2 to 3 times with progressively more force. A positive test, pain at area of complaint. Positive test implication means possible fracture. For a Tinel sign test, athlete is supine with the hip of the affected side externally rotated and the foot slightly everted. Examiner taps over the tarsal tunnel. A positive test means radiating pain in the foot and toes. Positive test implications, tarsal tunnel syndrome. For the varus/valgus stress testing of the MTP, athlete is supine or sitting with his or her knees extended. Examiner stands lateral to the involved foot. Examiner stabilizes the proximal bone close to the joint to be tested. Examiner grasps the bone distal to the joint to be tested near the middle of its shaft. Examiner moves the distal bone medially/laterally, attempting to open up the joint. A positive test, increased laxity or pain. Positive test implications, collateral ligament sprain. Intermetatarsal glide test. Athlete is supine or sitting with his or her knees extended. Examiner is standing in front of the athlete's feet. Examiner grasps the head of the 2 metatarsals. Examiner moves the 2 metatarsals heads in opposite directions. Examiner repeats the procedure until all 4 intermetatarsal joints have been evaluated. A positive test, pain or increased glide. Positive test implications, trauma to deep transverse metatarsal ligament and or interosseous. Interdigital neuroma test. Athlete is positioned in the supine position on the table. Examiner uses the eraser end of a pencil to apply pressure to the intermetatarsal space. Ow! A positive test, replication of symptoms / increase of symptoms. A positive test means interdigital neuroma. A fracture test. Athlete is supine or seated with his or her feet off the end of the table. Examiner grasps the foot around the midshaft of the metatarsals and squeezes metatarsals or compresses the bone from one end to the other and rotates the bone. A positive test, pain or crepitus. A positive test implication, possible metatarsal fracture. Supple pes planus test. Athlete is sitting on the edge of the table. Examiner is positioned on a stool facing the athlete. Examiner notes the presence of a medial longitudinal arch. Examiner has the athlete stand with his or her body weight evenly distributed. A positive test is medial longitudinal arch disappears when weight bearing. Positive test implications, supple pes planus. Windlass test. Stresses the plantar fascia. The patient is in supine position with examiner at the side. The examiner passively extends the patient's great toe with the ankle in dorsiflexion. A positive sign is a reproduction of symptoms, and the implications are plantar fasciitis.